infected with Varicella Zoster virus. Infected mouse with the varicella. Antibody from vaccinated to infected mouse equals Hello, my name is Brian, and today we are with Dr. Cedric Benson. It's an honor and great pleasure to see what Dr. Benson has to talk about in Varicella Zoster virus. Without further ado, here's Dr. Benson to talk about the Zoster virus.
Hello, my name is Dr. Benson, and I'm a hospitalist physician. I'm trained in internal medicine, and I'm happy to be here.
Thank you. So what exactly is a Varicella Zoster virus?
The Varicella Zoster virus is one of the human herpes viruses that infects humans. DNA virus, which is highly contagious, and it most commonly infects humans during childhood because of how highly contagious it is. I think that the Varicella Zoster virus is better known as the virus that causes chickenpox and shingles.
How does one get chickenpox or Varicella Zoster virus?
The virus is typically transmitted through a few different routes. Most commonly is from aerosolized particles from nasopharyngeal secretions. Also, you can get it through direct contact from the virus particles in the fluid-filled vesicles that occur from the rash.
Who's mainly affected by this disease?
Really, varicella will infect everyone, but most commonly it will be found in childhood. It can also infect adolescents, adults, and immunocompromised individuals, and that in those individuals it will typically cause more severe disease.
And how does it look? What's its general appearance?
Initially, once someone is infected with the virus, there's about a 2-week incubation period. Following that, a person will experience viral prodrome. And they might have symptoms of a fever, headache, sore throat, malaise, and then about 24 hours later, they'll begin to have the viral rash, the classic rash that's disseminated on the face, the trunk, the extremities, and one of the classic features of the rash is that it occurs in different stages. Initially, it starts off as a spot, and then can develop into a bump, and then a fluid-filled vesicle, and later a crusting lesion. All of those phases can be seen on the same person at the same time. And notoriously, also, the rash is quite itchy.
What are some of the complications?
Okay. In children, most commonly, they like to scratch the rash. So there can be bacterial infections, super infections really, on areas where they're scratching. So skin infections will be most common in children. In adults, the disease is more severe, and same thing with immunocompromised individuals. So in those individuals, you might see more of the tougher illnesses such as encephalitis, meningitis. They can have pneumonias, and commonly the pneumonia will be one of the severe illnesses that causes death in patients that, and high mortality in patients that suffer from varicella. It also notoriously causes and has been implicated in Rye syndrome, in children. A lot of times when children would be infected with varicella, they would take aspirin and suffer very horrible symptoms, including nausea, vomiting, and could even become comatose and die from Rye syndrome.
So once a person is infected, how can they be cured? What's the treatment?
For someone who has who is infected with the disease, who, for example, might be immunocompromised, or an adult with pneumonia, it would be best to treat them with acyclovir. Acyclovir is a nucleoside analog, and it's a competitive inhibitor of the viral DNA polymerase. And acyclovir is an excellent medication because it prefers the viral DNA polymerase as opposed to the hosts. The acyclovir is usually given for about 7 to 10 days. But actually, really the best way to treat the Varicella Zoster virus is to prevent it from happening altogether. And that's with the vaccine.
And how does the vaccine actually work?
The vaccine is a live attenuated form of the virus, which is given in 2 doses, typically given...
Excuse me, Dr. Benson. Respiratory. Yes, we'll be there, staff.
Yes, I got my vaccine. Woo, woo.